So let's start. Quickly answer. I'll not be waiting too much because this is something which we have even put it in the WhatsApp group for you to answer it. So which of the following is characterized by pansystolic murmur, dilated aortic arch, and irregular pulse? One disease. Okay, pansystolic murmur. You know it very clearly now. Okay, it is Marfan syndrome. I'll come to that. We have to discuss a little bit detail on Marfan syndrome. But then what is the key here? What is the most important cardiac feature of Marfan syndrome? Anyone? Mitral regurgitation and mitral valve prolapse, MR. Mitral regurgitation, I told you, mitral regurgitation is the key here as the pansystolic murmur. Okay, another very important cardiac manifestation of, I'll come to basics of why this is happening. Basically, the problem is an elastin. And you know that elastin is an elastic structural protein which gives elasticity to the vessels, even vessel skin, everything. So all these blood vessels are lined by this particular elastin. So understandably, you have this problem. So dilated aortic arch, which gives further complications, I'll tell you that, and irregular pulse. Now, this is not a very specific, this is related to your atrial fibrillation, which is very common again in your Marfan syndrome. Okay, and please note one point I just want you to note here is rheumatic fever. Also, we saw that there is pansystolic murmur, isn't it? I told you pansystolic is, but then they don't have what? They don't have dilated aortic arch. They don't have irregular pulse, and more importantly, it's a kind of an infection. Okay, so it's a kind of a different features in it in itself. Okay, so and aortic stenosis. What is it? What is the problem? What is a murmur associated with aortic stenosis? Anyone? Which systolic? Ejection. I told you, aortic stenosis is ejection systolic. It is not pansystolic. Now, again, ejection systolic is throughout the ejection phase. Okay, but then that's a name. It's not pansystolic, definitely. So pansystolic throughout the systole only. Ejection systolic, again, it's a kind of similar, but then yeah. ANCA vasculitis. Just to know, ANCA vasculitis is an autoimmune disease. Okay, autoimmune disease which is affecting your smaller vessels. Okay, autoimmune disease affecting your smaller vessels. So not the larger cardiac vessels or cardiovascular manifestations are very little. It is basically localized vascular manifestations. So you don't get this big murmurs and all this. Okay. So let's come to a little bit on your Marfan syndrome. The first thing which you have to note here, is it is autosomal dominant condition. Okay, it's an autosomal dominant condition affecting 15th chromosome, the Q. Okay, the Q, what do you call it? The smaller Q arm, isn't it? Q and P arm. So no, P is smaller. So P smaller, Q, the larger arm. So it's the 15q chromosome basically, and due to that effect, what you get? You get a problem with a particular fibrillin, a protein called a fibrillin. Okay, a mutation of this fibrillin gene, the gene which produces fibrillin. Now, what is the importance of fibrillin? Fibrillin is a scaffolding, so it covers, a scaffolds your elastin. As I've told you, this elastin is there everywhere. It is there in the skin, it's there in the ligaments, it's there in the blood vessels, it's there in the aorta, everywhere. So all these manifestations are affected. So basically, fibrillin, that's one question. Fibrillin 1 gene. So they'll confuse you. Fibrillin 1, 2, 3. It's basically fibrillin 1 gene. Okay, fibrillin 1 gene. That's a basic thing. Now, one thing, okay, this is basically, yeah, this is what is the, okay. I'll do one thing. I'll first discuss the points. Marfan syndrome. There's a picture also. I'll show you that. Okay. Yeah, we'll discuss here. So basically, this is what is your aortic dilation, and so basically, this is your dilation of the aorta. Okay, how your aorta dilates, and a little bit more dilation is called a aneurysm. Okay, aneurysm is nothing but dilation of your aorta. And then once you're, I'll give more details on this. Once there is a break in the layers, there are different layers: intima, media, externa. So once there's a break, it's called aortic dissection, and this leads to death of the patient. Once that is, aorta is dissected, dissection means broken. So it becomes weak. Okay, by dilatation, it becomes weak, degeneration and all. We'll come to that. I just saw this picture. I want to explain this. So that was fibrillin 1 gene being affected, as what I said. Now there are some features which you have to know. How many of you know the short form of the features of Marfan syndrome, the key features? Easiest, it's to learn Marfan's only. Okay, so M is for most important mitral regurgitation or mitral valve prolapse. Okay, then A for aortic aneurysm. I told you, aortic aneurysm, which finally leads to aortic dissection, which we saw. Okay, aneurysm and dissection. Please note an additional point here. This aortic aneurysm, this dissection, all those are seen in Ehlers-Danlos, which is actually a problem with collagen. I told you. Okay, and one more, the tertiary. Okay, tertiary stage of syphilis. Just an add-on point. See, one thing I just want to advise you here. Now you are learning these points here, and you're connecting it. Your basics you're learning as syphilis, infections, isn't it? Infections in microbiology. But then once you learn that, you connect it to it. For example, next we're going to go for microbiology. You learn syphilis. You'll learn details on syphilis. Okay. So once you learn that, you connect it. Or now you learn it, you connect it. It's not like you're going to learn everything about syphilis now. That is not the way. You just need to connect some features. But then your basics has to be in a very systematic way. Okay, don't in a wrong methodology. So that is about it. Now R. What is R? Retinal detachment. Okay, I should be using the blue color only. Retina gets detached. Okay, retina is a very important layer for your vision, isn't it? It's get detached. You're going to see some retinal problems associated with some other lesions also later on. And then we have got this, just for a mnemonics perspective, it's freely movable joints. Okay, freely movable joints or hyperextensive joints. Another point to note here is fibrillin 1 gene. So 2F is there here. Okay, I'll just use a different color so that you don't. Okay. So that is fibrillin gene. A is for arachnodactyly. Arachnodactyly. I can connect it to many lesions here, but I don't want to confuse you. Anyone knows any lesion which is related to arachnodactyly? Oral pathology. Arachnodactyly is like long and slender fingers. Okay, very long. Basically, these patients are, so that is this is next short form, 9 feet height. Just to remember, it's not the exact 9 feet height, but it's a very long patient. So arachnodactyly. Next is subluxation. Okay, not TMJ. We'll see subluxation of TMJ and another lesion. This subluxation or dislocation of your lens. Okay, we can use two terms: dislocation or subluxation of lens of your eye. I'll show you a picture of that lens being displaced into your anterior chambers of the eye. So retina. Okay, I think there's a picture there. Later I'll show you, no problem. Retina gets, no one knows, no problem, we'll study that. Retina gets detached, okay, and your lens also gets detached. This particular detachment has got a specific term and very important diagnosis, which is called ectopia lentis. Okay, ectopia lentis. So these are the key terms here. Okay, and death in these patients. Okay, death in patients with Ehlers-Danlos, death in patients with Marfan syndrome, all occurs basically due to aortic dissection. Okay, aortic dissection. We'll come to that. So this is the major features. Now a little bit more. I just want. Okay, this is the picture. Very long patient. Okay, very tall patient. In fact, eye problems. What was that? Ectopia lentis and detachment of the retina. Okay, abnormal chest and things I'll show you. Short torso, this area is very short. Tall, thin, long. Okay, basically it's a long patient. Okay, I'll show you another question there. Okay, same thing. Yeah. So basically, it's a chromosome number 15. Okay. So anyone remembers any lesions we studied in general pathology? It is associated with chromosome number 15. Let this be a discussion, isn't it? Marfan syndrome is definitely. So I'll just put it as a map. Map of 15th chromosome. What are the lesions? Someone please tell me quickly. M is for Marfan's. I'll give you a clue. The other lesions associated with genomic imprinting. No revision. Genomic imprinting. One is starting with A and second is starting with P. Those have not learned, don't worry. Two lesions only, I think, we studied in genomic imprinting. Two diseases. What are they? Parvati, Manju. I hope you were there. For general pathology. Revision is the key. Okay, revision has to be. Not there, Manju, Parvati. Anyone was there? Or those who were there got tired and stopped? This is what happens, you know. This is what I was saying. You majority, what happens is that they think I am not able to learn things. They are not waiting. They are not persisting. That will happen. That would have happened for them. Okay, it is not Patau syndrome. Or I'll give it. It is Angelman syndrome. Angelman syndrome, and P for Prader-Willi syndrome. If you have not learned, we'll learn this in detail and what it is exactly. It is associated with just right genomic imprinting. Both this, not all, these two. Okay, these two are associated with genomic imprinting. What genomic imprinting is uh, basically what happens here is your the paternal allele gets deleted. Here the maternal mother's allele get deleted. So both of them will have a different symptom. That's called genomic imprinting on the 15th chromosome. All these are problems associated with 15th chromosome. Okay, so just three disease map. Okay, Marfan's, Angelman, Prader-Willis. Okay, so let's go to the next part. Okay, now a little bit more on your Marfan syndrome on diagnosis. Okay, we said one of the most important lesions is eye lesions, ectopia lentis and retinal detachment. So to check for the eye, you do something known as slit lamp test. We do this in one of the oral pathology lesion also. What is that? Slit lamp examination. Anyone? Jokeren syndrome. Okay. Now, that is one test. Now, second thing is you do echo. Okay, and all those things to identify the murmurs and everything. You know it. Now, there is a very, very, very important criteria known as Gens criteria or international Gens criteria, where you have got some major criterias and minor criterias. I'm going to discuss the major criteria. Minor, all those you have learned. Lots of things are there. Okay, forget about it. It'll never end. It is non-ending. Okay. Did we miss anything? No. Yeah, it's all fine. Yeah, one small area is there. I'll come to that. Those are the major criteria. So basically, we all said the major criteria, one of the major lesion is your skeletal abnormalities. And the patient is very tall and all those things. So any four, okay, please note, any four skeletal abnormalities. Okay, whatever it is, long fingers, arachnodactyl, whatever it is. But then two terms are there which you should be aware about. It is called pectus carinatum. Okay, pectus carinatum and pectus, okay, little complicated, excavatum. So what is excavatum? Excavated. sunken, go on inside. Carinatum is protruding. So basically, pectus is something related to your chest. So carinatum is something where your chest, the patient's chest is protruding. Okay, protruding. I'll show you the pic. Excavatum is sunken inside. So these two are among the major criteria. Where is that? Okay, this is it. This is a sunken excavatum. This is protruding. See this. Okay, so just that's one of the major criteria. Now, second major criteria, we already said it is ectopia lentis. The lens gets displaced or dislocated. Ectopia lentis. Third is your aortic dilatation. That's a very important. Okay, dilatation or aneurysm or dissection, whatever you see it. And finally, one more which we have been said is dural ectasia. There's a term there. So basically, it's a dural. You know what is okay? Dural ectasia, to be very specific, of spinal cord. Spinal cord. Now, basically, you know that there is meninges in the around the brain. There is also meninges in the spinal cord that has got a covering called the dura, arachnoid and pia, isn't it? So this dura gets enlarged. That's called dural ectasia. That's it. The dural sac gets enlarged. That's called dural ectasia. And that these are the four major criteria. That is skeletal, any four, ectopia lentis, aortic dilatation, dural ectasia. So if any of those four is there, it is being considered to be the major, fulfilling the major criteria. I think that's it. So this is the basic understanding of your Marfan syndrome. Okay, what's the answer for this? Quickly, all the characteristics of Marfan syndrome except. Okay, you're confused between a high arched palate or high arched foot, isn't it? Actually, okay, there is highlighted also. The answer is exception is a high arched foot, which is not a feature. Now, can anyone tell me any other lesion which is associated with high arched palate, even cleft lip and palate also associated with that? High arched palate, just give me two lesions. This is how advanced discussion will go. It is actually conditions associated with premature closure of your, exactly, very good. Who is that? Cleidocranial dysplasia. Cleidocranial dysplasia. One more is Krausen syndrome. Both of this you have high arched palate. One very typical lesion, Mahavesh, which is associated with cleidocranial. Very typical. Absent of a particular bone, anyone. A particular bone is missing in this patient and they can bring their shoulders closer. What is that bone missing there? Exactly, clavicle. Yes, clavicle, exactly. Just to know that, just to connect, high arch palate. Okay, let's see to the next. Anything I'm missing out? Okay. Okay, very simple. Now this is where you learn it, you forget it. Is it fibrillin 1? Is it fibrillin 2? What is the answer? Fibrillin 1 or 2? No, this is what you call it as, this will be a terrifying thing. You have learned everything about Marfan syndrome. Be very careful on this part. Okay, you have learned everything about Marfan syndrome. One thing you forgot is 1 or 2, because you learned collagen 1 is there, collagen 3 is there, different 1, 2, 3 is there. So it is actually fibrillin 1, don't forget. Okay. Okay, this is another very important question. Cystic medial necrosis. Don't always jump onto one particular syndrome if you're learning that. You're going to shift it. Cystic medial necrosis. What is that? You have your blood vessel, okay, which has got 3 layers. Outer layer is called adventitia, the middle layer is called media, and the inner layer is called intima. Okay, and this within that is your flow of blood which is happening inside this. What's the answer? Answer me. Okay, I'm just saying this. If you know the answer, tell me. So, as I've told you, the blue one which is your media, the middle layer. Oh, that is medial layer gets degenerated in a particular condition, and this degeneration lead to necrosis. This necrosis leads to destruction or dissection. Okay. And if it is on the aorta, it is called aortic dissection. Okay. So this necrosis, this degeneration can lead to some cystic space formation. Okay, this can lead to some cystic space formation in between in this layer, and finally leading to dissection, break. Okay, what happens is that there is a break completely in these two layers. Okay, and yeah, you see that your blood is flowing into that. We'll come to this. Will form a false lumen, a separate channel for the flow of blood. So this is called aortic dissection. So all this is due to basically the cystic the medial layer get necrosed. Okay, and it is a very important feature, very important feature of Marfan syndrome, which we were discussing. Okay, so basically it is also seen in other conditions. Okay, especially now see, this is what one statement I saw, and I was a little perplexed by this, taken from your Sparsh Gupta. It says that, okay, it is explaining about your cystic degeneration. It is saying that this is seen in Marfan syndrome and scurvy. Scurvy is what? Vitamin C deficiency. I don't know if it is seen. I searched in different areas. I couldn't find that scurvy is associated. But then, if Sparsh Gupta is saying it, it should have some meaning. And scurvy is a very important lesion as dentists are concerned, because it has got gingival bleeding, gingival enlargement, isn't it? So you good to know that. Okay. CNN. Okay. Medial degeneration. Okay. Now a little bit again associated conditions. Okay. So the answer, someone said yeah, Marfan syndrome. You're right. So this is medial degeneration leading to dissection, aortic dissection. Okay. Now another question. Most common cause of dissecting hematoma, or other name is aortic dissection. Hematoma, why are they saying hematoma? Because the blood is flowing into which color will I use? Okay, the blood, okay, red only. The blood is coming here and it is getting inside here. It is looking like sorry, it is looking like hematoma. So it is dissecting hematoma. So the most common cause of dissecting hematoma, what is the answer? Most common cause. Quickly. Now, I know all of you will answer B, but the answer is A. The most common cause is hypertension. Okay. So most common cause is hypertension. Don't forget. Marfan syndrome is also a cause of it. As I've told you, Ehlers-Danlos syndrome. We saw, isn't it? There is aortic aneurysm, aortic. So if there is aortic aneurysm, there is also Ehlers-Danlos syndrome. Then in trauma, okay, and in Turner syndrome. So all these are associated with your aortic dissection. So don't forget hypertension. If you want to remember, first one is Marfan's syndrome. So if you want to remember a short form, it is MET, METT or MET. Okay, aortic dissection, don't forget. Aortic dissection is a complicated area of aneurysm. Please note this. Aneurysm is just a dilatation. Dissection is cutting in the blood coming out of it. So these two are two different conditions. The most common cause. Now, why is the dissection happening in hypertension? Understandably, the blood is flowing at a very fast pressure. BP is very high. It can dissect slowly by slowly, it can dissect. We saw why it is happening in Marfan's. What is that? What is the cause? Medial degeneration. Ehlers-Danlos, why? Collagen problem. Trauma can naturally happen. It Turner syndrome, again related to some genetic defects. Okay. So yes, yeah, this is a typical picture you can see here. So yeah, I think I'll use blue. So normally this is the blood flow. What happens is The blood flow, there's another false cavity being created, okay, which causes the blood to flow into that, okay, and leading to this particular problem. That is a pseudo lumen creation. Okay, yeah, this is it. Which one? This one. Okay, okay, this one you can call it. Now, please note there's a condition where you will get the blood here. Okay, where your outer wall is also broken, your outer layer is also broken, adventitious is also broken, which is definitely will come to that.